A high fever, persistent cough, lack of smell or taste. Everyone's aware of the official symptoms of COVID-19, but as the virus changes, so too do the most common signs. So with a new variant here in Britain, what symptoms should you be looking out for? Much is still unknown about Omicron, with scientists the world over racing against the clock to unpack the new variant's potential for harm. They want to know if it really does spread faster, whether it can circumvent people's immunity, and if it changes the severity of the disease. And to see why scientists are so desperate to find out, just take a look at these illustrations released by the COVID-19 Genomics UK Consortium. Here you can see a comparison between the mutations present in the Delta variant, currently dominant in the UK, and the new strain, Omicron. What has experts anxious is the number of mutations in the new strain, in particular the 32 on its spike protein, the part of the virus which attaches to human cells. Most of our current vaccines and treatments are targeted at these spike proteins, with the worry being that some of Omicron's 32 mutations could mean our antibodies are less able to fight it off. Many of Omicron's mutations cross over with those seen before in previous dangerous strains. However, some are novel. Along with these genetic changes, it's believed that the new variant is generating some unusual symptoms. So what do you need to be on the lookout for? And what should you do if you experience them? Dr. Angelique Coetzee, a private practitioner and chair of the South African Medical Association, who was one of the first to uncover the new variant, described the main symptoms she'd seen in patients testing positive for Omicron.
The most predominant clinical complaint is severe fatigue for 1 or 2 days, with then the headache and the body aches and pain. Some of them will have what they call a scratchy throat, and some will have a cough, a dry cough, but it's not a constant cough, it comes and goes.
She also described an isolated case of a 6-year-old girl who experienced more severe symptoms.
Temperature, I only had one child that was severely ill with a temperature of what we call 40 degrees and with quite a fast pulse rate.
There are several reasons Omicron may be associated with less severe symptoms. It could be that the virus has mutated to cause a milder illness. It could also be because many of the people who've been infected so far have been vaccinated, which dampens the severity of coronavirus. It may be to do with the ages of those who've caught it. So far, it seems to be largely spreading amongst the younger and therefore less vulnerable population. If you're experiencing any symptoms of COVID, you should always get a PCR test to make sure. It's also a good idea to take a lateral flow test before heading out to any large events, like Christmas parties. For now, experts are cautious to stress that all knowledge about this variant is in its infancy. What is certain is that until scientists gather more evidence, there is going to be little certainty about Omicron.